Question 1. A pharmacy technician receives a prescription for Celexa 20 mg. The technician should identify that this medication is primarily indicated for which of the following conditions? A. Hypertension. B. Hyperlipidemia. C. Depression. D. Type 2 diabetes. Answer: C. Depression. This question tests knowledge of common drug indications, specifically for a top 200 drug. The keyword Celexa should immediately bring to mind its generic name, citalopram, and its primary therapeutic use. Celexa, citalopram, is an antidepressant belonging to the selective serotonin reuptake inhibitor, SSRI, class, which is prescribed mainly for treating major depressive disorder. Understanding the main use of medications like citalopram is crucial for patient safety and for accurately answering patient questions, even if a technician cannot counsel directly. Always associate common brand/generic names with their primary use to avoid errors. Question 2. A prescription is received for Lantus Solostar 100 units/ml, inject 20 units subcutaneously every evening, dispense 2-3 ml pens. How many days supply does this prescription provide? A. 15 days. B. 30 days. C. 45 days. D. 60 days. Answer: B. 30 days. This question requires a dosage calculation to determine the day's supply, a common task for pharmacy technicians. The keywords are 20 units subcutaneously every evening and 2-3 ml pens, with each pen containing 100 units/ml. First, calculate the total units in one pen. 3 ml * 100 units/ml equals 300 units. Since 2 pens are dispensed, the total units are 2 by 300 units equals 600 units. Finally, divide the total units by the daily dose. 600 units/20 units/day equals 30 days. Accurately calculating days' supply is essential for billing, managing refills, and ensuring patients have enough medication. Question 3. Under California law, what is the maximum number of controlled substance Schedule 3, 4, or V, C3, C4, CV refills permitted on a single prescription, if authorized by the prescriber? A. 3 refills. B. 5 refills. C. 6 refills. D. 12 refills. Answer: B. 5 refills. This question assesses knowledge of controlled substance regulations, a critical aspect of pharmacy law in California. Federal law, which California largely mirrors in this aspect, limits Schedule 3, 4, and V prescriptions to 5 refills within 6 months from the date the prescription was written. The keywords are California law, controlled substance Schedule 3, 4, or V, and maximum number of refills. Adhering strictly to controlled substance refill limits is vital for preventing diversion and misuse. Remember, for C2 medications, no refills are permitted. Question 4. A pharmacy receives a prescription for amoxicillin suspension 250 mg per 5 ml with directions to take 500 mg 3 times daily for 10 days. The bottle size available is 150 ml. How many bottles should the technician dispense? A. 1 bottle. B. 2 bottles. C. 3 bottles. D. 4 bottles. Answer: B. 2 bottles. This question involves multiple steps of calculation, including dose conversion and total volume needed. First, determine the volume for a single dose. If 250 mg is in 5 ml, then 500 mg, the prescribed dose, is in 10 ml. Next, calculate the total daily volume. 10 ml per dose * 3 doses/day equals 30 ml per day. Over 10 days, The total volume needed is 30 milliliters per day * 10 days equals 300 milliliters. Since each bottle contains 150 milliliters, the technician needs to dispense 300 milliliters / 150 milliliters per bottle equals 2 bottles. Always double-check your calculations, especially when converting between different units and concentrations, to ensure patient safety and correct dispensing. Question 5. Which of the following conditions would require a medication to be dispensed with a medication guide by the pharmacy? A. All new prescriptions. B. Medications with significant risks requiring patient awareness. C. All over-the-counter medications. D. Medications covered by government insurance programs. Answer: B. Medications with significant risks requiring patient awareness. This question tests understanding of federal requirements for patient information, specifically medication guides. The keyword medication guide refers to FDA-approved patient handouts that provide important information about certain medications, especially those with serious risks, to help patients avoid adverse events. These are not required for all prescriptions or OTC medications but are specifically mandated for drugs with significant public health concerns or complex instructions. For example, isotretinoin for acne or certain antidepressants often require a medication guide due to their potential serious side effects or specific monitoring needs. Always remember that medication guides are a tool for patient safety, highlighting crucial information for high-risk medications. Question 6. A technician is processing a prescription for warfarin. What is a crucial counseling point for patients regarding their diet while taking this medication? A. Avoid all leafy green vegetables. B. Consume a consistent amount of vitamin K-rich foods. C. Increase intake of grapefruit juice. D. Limit protein consumption. Answer: B. Consume a consistent amount of vitamin K-rich foods. This question assesses knowledge of critical drug interactions and patient counseling points for high-alert medications, specifically warfarin. The keywords warfarin and diet highlight the need to recall its interaction with vitamin K. Warfarin's anticoagulant effect can be significantly altered by variations in vitamin K intake, as vitamin K is essential for clotting factor production. Therefore, patients should maintain a consistent intake, not avoid or excessively consume vitamin K-rich foods like leafy greens. Providing accurate and consistent information about warfarin's dietary interactions is vital for preventing serious bleeding or clotting complications. Question 7. According to USP Chapter less than 797, what is the maximum beyond use date, BUD, for a low-risk sterile compounded preparation stored at room temperature, 20 to 25 degrees Celsius, if not subject to sterility testing? A. 12 hours. B. 24 hours. C. 48 hours. D. 72 hours. Answer: C. 48 hours. This question tests specific knowledge of USP less than 797 guidelines, which are critical for sterile compounding safety. The keywords USP Chapter less than 797, low-risk sterile compounded preparation, room temperature, and not subject to sterility testing direct you to the standard BUD tables. Low-risk compounded sterile preparations, CSPs, that are prepared in an ISO Class 5 environment and stored at room temperature have a BUD of 48 hours. Adhering to these BUD limits is crucial for preventing microbial contamination and ensuring patient safety in sterile compounding. Familiarize yourself with the different risk levels and their corresponding BUDs for various storage conditions. Question 8. A patient presents a prescription for Synthroid 100 micrograms. Which of the following is the most appropriate generic substitution for this medication? A. Levothyroxine. B. Liothyronine. C. Thyroglobulin. D. Desiccated thyroid. Answer: A. Levothyroxine. This question assesses knowledge of brand generic drug equivalencies, a fundamental aspect of pharmacy practice, and the top 200 drugs. The keyword Synthroid should immediately bring to mind its widely recognized generic equivalent. Synthroid is a brand name for levothyroxine, a synthetic thyroid hormone used to treat hypothyroidism. While the other options are also thyroid medications, only levothyroxine is the direct generic equivalent for Synthroid. Accurately identifying generic equivalents is crucial for medication dispensing, inventory management, and ensuring therapeutic interchange where appropriate. Question 9. A pharmacy technician receives a prescription for Restoril 15 mg number 30. What is the DEA schedule for this medication? A. Schedule 2, C2. B. Schedule 3, C3. C. Schedule 4, C4. D. Schedule 5, CV. Answer, C. Schedule 4, C4. This question tests knowledge of controlled substance scheduling, which is vital for proper handling and record keeping. The keyword Restoril refers to temazepam, a benzodiazepine. Benzodiazepines, including temazepam, are generally classified as Schedule 4 controlled substances due to their potential for abuse and dependence, though less than C2 or C3 drugs. Correctly identifying the DEA schedule is essential for inventory, dispensing, and adhering to legal requirements for controlled substances. Question 10. Which federal law requires a pharmacist to offer counseling to Medicaid patients regarding their prescriptions? A. Health Insurance Portability and Accountability Act, HIPAA. B. Occupational Safety and Health Act, OSHA. C. Omnibus Budget Reconciliation Act of 1990, OBRA 90. D. Poison Prevention Packaging Act, PPPA. Answer, C. Omnibus Budget Reconciliation Act of 1990, OBRA 90. This question tests knowledge of significant federal pharmacy laws. The keyword Medicaid patients and offer counseling are direct indicators for OBRA 90. This act mandated that pharmacists must offer to counsel Medicaid patients about their new prescriptions to ensure appropriate drug utilization and improve patient outcomes. While technicians cannot counsel, understanding this law is important for knowing the pharmacist's responsibilities and the technician's role in facilitating patient access to this counseling. Remembering OBRA 90's focus on counseling for Medicaid patients will help you distinguish it from other federal laws. Question 11. A pharmacy technician is preparing a non-sterile compound that requires mixing 30 grams of an active ingredient into a total of 150 grams of cream. What is the percentage strength, W/W, of the active ingredient in the final compound? A. 15%. B. 20%. C. 25%. D. 30%. Answer, B. 20%. This question requires a basic percentage strength calculation, a common task in non-sterile compounding. The keywords are 30 grams of an active ingredient and 150 grams of cream. To find the percentage strength, weight/weight, you divide the weight of the active ingredient by the total weight of the final compound and then multiply by 100. So, 30 grams/150 grams, asterisk 100% equals 0.20 by 100% equals 20%. Accurate calculation of concentrations is vital for patient safety and therapeutic efficacy in compounded preparations. Question 12. Which of the following drug classifications is most likely to be involved in a risk evaluation and mitigation strategy, REMS, program? A. Over-the-counter pain relievers. B. Vitamins and dietary supplements. C. Medications with serious safety concerns and potential for severe adverse effects. D. Generic versions of commonly prescribed antibiotics. Answer, C. medications with serious safety concerns and potential for severe adverse effects. This question assesses understanding of risk evaluation and mitigation strategies, REMS. The keyword REMS should trigger recall of its purpose. REMS programs are FDA-mandated strategies designed to manage known or potential serious risks associated with a drug and to ensure that the benefits of the drug outweigh its risks. They are specifically implemented for medications with serious safety concerns, such as isotretinoin, for severe acne, or certain opioids, which require specialized patient education, monitoring, or restricted distribution. Understanding REMS programs is crucial for pharmacy technicians to properly handle and dispense these high-risk medications. Question 13. In California, what is the required minimum time period a pharmacy must keep prescription records on file? A. 1 year. B. 2 years. C. 3 years. D. 5 years. Answer: C. 3 years. This question tests specific knowledge of California state pharmacy law regarding record-keeping requirements. The keywords California, minimum time period, and prescription records are crucial. Under California Board of Pharmacy regulations, all prescription records must be maintained for a minimum of 3 years from the date of dispensing. Proper record-keeping is essential for legal compliance, auditing, and patient safety, allowing for tracking and recall if necessary. Always ensure compliance with state-specific regulations, as they can sometimes differ from federal guidelines. Question 14. A prescription calls for an intravenous, 4, infusion of 1,000 milliliters of D5W to be administered over 8 hours. The 4 administration set delivers 15 drops/ml. What is the correct drip rate in drops per minute, GTTS/min? A. 21 GTTS/min. B. 31 GTTS/min. C. 42 GTTS/min. D. 63 GTTS/min. Answer: B. 31 GTTS/min. This question requires a multi-step 4-drip rate calculation, a critical skill for pharmacy technicians in hospital settings. The formula for drip rate is volume in ml * drop factor in GTTS/ml / time in minutes. First, convert 8 hours to minutes. 8 hours * 60 minutes/hour equals 480 minutes. Then, plug the values into the formula. 1,000 milliliters * 15 GTTS/ml / 480 minutes equals 15,000 GTTS / 480 minutes is almost equal to 31.25 GTTS/min. When calculating drip rates, it is common to round to the nearest whole number, so 31 GTTS/min is the correct answer. Accuracy in 4 calculations directly impacts patient safety and therapeutic outcomes. Question 15. A pharmacy technician receives a prescription for Adderall XR 30 mg. What specific instruction should be provided to the patient regarding its administration? A. Take with a full glass of milk to prevent stomach upset. B. Do not crush, chew, or divide the capsule. C. Take before bedtime to ensure a full night's sleep. D. Avoid all food when taking this medication. Answer: B. Do not crush, chew, or divide the capsule. This question assesses knowledge of specific drug administration instructions, particularly for extended-release formulations. The keywords Adderall XR and administration are important. XR indicates an extended-release formulation, which means the medication is designed to release slowly over time. Crushing, chewing, or dividing such capsules would destroy the extended-release mechanism, leading to a rapid, potentially dangerous release of the entire dose at once. Proper administration instructions are crucial for maintaining the intended therapeutic effect and preventing adverse events. Question 16. In California, What is the maximum number of pharmacy technicians a single pharmacist may supervise at one time? A. 1 technician. B. 2 technicians. C. 4 technicians. D. The number is determined by the pharmacist in charge based on workload. Answer: C. 4 technicians. This question tests specific knowledge of California Board of Pharmacy regulations regarding pharmacist-to-technician ratios. The keywords California, maximum number, and single pharmacist are critical. California law generally permits a pharmacist to supervise a maximum of 4 pharmacy technicians at one time. However, this ratio can vary in specific settings or under certain waivers. Knowing these ratios is essential for maintaining proper staffing, ensuring adequate supervision, and complying with state law to support patient safety. Question 17. A patient needs to take 5 milliliters of a liquid medication every 6 hours. If the bottle contains 240 milliliters, how many days will the medication last? A. 6 days. B. 8 days. C. 10 days. D. 12 days. Answer: D. 12 days. This question requires calculating the total daily dose and then determining the day's supply. The keywords are 5 milliliters every 6 hours and bottle contains 240 milliliters. First, calculate the number of doses per day. 24 hours/6 hours per dose equals 4 doses per day. Next, find the total daily volume. 5 milliliters per dose * 4 doses/day equals 20 milliliters per day. Finally, divide the total volume in the bottle by the daily volume. 240 milliliters/20 milliliters per day equals 12 days. Accurate days supply calculations are essential for managing refills and ensuring patients have enough medication. Question 18. Which of the following scenarios best describes a look-alike/sound-alike, LASA, medication error risk? A. Dispensing a generic medication instead of a brand-name medication. B. Dispensing a medication with a similar appearance and name to another, leading to confusion. C. A patient picking up the wrong prescription due to a similar last name. D. Administering a medication via the wrong route due to unclear instructions. Answer: B. Dispensing a medication with a similar appearance and name to another, leading to confusion. This question tests understanding of a common medication error source, look-alike/sound-alike, LASA, drugs. The keywords look-alike/sound-alike are the core concept. LASA errors occur when medications have similar names, sound-alike, e.g., hydroxyzine and hydralazine, or similar packaging/appearance, look-alike, e.g., insulin vials and certain vaccines, leading to confusion and potential dispensing errors. Pharmacists and technicians must be vigilant in identifying and mitigating LASA risks through strategies like tall man lettering and double checks. Question 19. A physician assistant, PA, calls in a verbal prescription for a Schedule II controlled substance, C2. Under California law, how should the pharmacy technician handle this? A. Process the prescription, as PAs can call in C2 prescriptions verbally. B. Inform the PA that verbal C2 prescriptions are not permitted and a written or e-prescription is required. C. Accept the verbal prescription but remind the PA to send a written copy within 72 hours. D. Consult with the pharmacist immediately to verify the PA's prescribing authority. Answer: B. Inform the PA that verbal C2 prescriptions are not permitted and a written or e-prescription is required. This question tests knowledge of California and federal law regarding controlled substance prescribing. The keywords physician assistant, PA, verbal prescription, and Schedule II controlled substance, C2, are crucial. Federal and California law generally prohibits verbal prescriptions for C2 medications except in very specific, documented emergency situations, which typically require the pharmacist to obtain a written prescription within a short time frame, usually 7 days. For routine prescriptions, a written or electronic prescription is always required for CIIs. Technicians must understand these rules to properly screen prescriptions and ensure legal compliance. Question 20. A patient receives a prescription for Lipitor. Which of the following laboratory tests should be routinely monitored for a patient taking this medication? A. Blood glucose, Bg. B. Thyroid stimulating hormone, TSH. C. Liver function tests, LFTs. D. International Normalized Ratio, INR. Answer, C. Liver function tests, LFTs. This question assesses knowledge of specific drug monitoring requirements for a common medication. The keyword Lipitor, atorvastatin, indicates it is an HMG-CoA reductase inhibitor, commonly known as a statin, used to lower cholesterol. Statins, while generally safe, have a known potential to cause liver damage, making routine monitoring of liver function tests, LFTs, important to detect any adverse effects. Understanding which lab tests are associated with specific drug classes is essential for recognizing potential adverse drug reactions and ensuring patient safety. Question 21. A technician is asked to prepare 500 milliliters of a 0.9% NaCl solution. How many grams of NaCl are needed? A. 0.9 grams. B. 4.5 grams. C. 9 grams. D. 45 grams. Answer, B. 4.5 grams. This question requires a percentage strength calculation to determine the amount of solute needed. The keywords are 500 milliliters, 0.9% NaCl solution, and grams of NaCl. A 0.9%, with V, solution means there are 0.9 grams of solute in every 100 milliliters of solution. To find the amount needed for 500 milliliters, set up a proportion, 0.9 g/100 milliliters equals xg/500 milliliters. Solving for x equals 0.9 g * 500 milliliters /100 milliliters equals 4.5 grams. Accurate calculations are fundamental in compounding and preparing solutions to ensure patient safety and correct drug concentration. Question 22. Which situation is not permitted for a pharmacy technician in California? A. Entering prescription data into the pharmacy computer system. B. Accepting a new prescription over the phone from a prescriber. C. Preparing labels for prescriptions. D. Packaging medication for dispensing. Answer, B. Accepting a new prescription over the phone from a prescriber. This question focuses on the scope of practice for pharmacy technicians in California, a critical area of pharmacy law. The keyword not permitted is key. Under California law, pharmacy technicians are generally not allowed to accept new prescriptions verbally from a prescriber or to clarify a prescription over the phone, as this is considered a professional judgment task reserved for a pharmacist. Tasks such as data entry, labeling, and packaging are within the technician's scope. Understanding the precise boundaries of a technician's role is crucial for legal compliance and patient safety. Question 23. A pharmacy receives a recall notice for a specific lot number of a medication due to potential contamination. What is the highest urgency classification for this type of recall, indicating a reasonable probability of serious adverse health consequences or death? A. Class 1 recall. B. Class 2 recall. C. Class 3 recall. D. Market withdrawal. Answer, A. Class 1 recall. This question tests knowledge of drug recall classifications, a critical aspect of quality assurance and patient safety. The keywords recall notice, potential contamination, and reasonable probability of serious adverse health consequences or death directly describe a Class 1 recall. Class 1 recalls are the most serious type, signifying that exposure to the product could cause severe harm or death. Class 2 recalls involve temporary or medically reversible adverse health consequences, and Class 3 recalls are for products unlikely to cause adverse health consequences. Understanding these classifications helps technicians prioritize and manage recalled products effectively to protect patients. Question 24. A patient has been prescribed metformin. The technician should recognize that this medication is primarily used to treat which condition? A. Hypertension. B. High cholesterol. C. Type 2 diabetes. D. Gastroesophageal reflux disease, GERD. Answer: C. Type 2 diabetes. This question assesses knowledge of common drug indications for a widely prescribed medication. The keyword metformin should immediately bring to mind its primary therapeutic use. Metformin is an oral biguanide antidiabetic agent, which is considered a first-line treatment for type 2 diabetes mellitus, helping to control blood sugar levels. Knowing the main indication of medications like metformin is essential for understanding patient profiles and ensuring medication accuracy. Question 25. A prescriber calls the pharmacy to transfer a Schedule IV prescription to another pharmacy. Which of the following is true regarding this transfer under federal law? A. A pharmacy technician can transfer the prescription to another pharmacy. B. Only a pharmacist can transfer the prescription to another pharmacist. C. The prescription cannot be transferred if it has already been filled once. D. Controlled substance prescriptions cannot be transferred. Answer: B. Only a pharmacist can transfer the prescription to another pharmacist. This question evaluates knowledge of federal law concerning prescription transfers, specifically for controlled substances. The keywords transfer, Schedule IV prescription, and federal law are crucial. Under federal law, prescriptions for Schedule III, IV, or V controlled substances can only be transferred one time, and this transfer must be done by a licensed pharmacist to another licensed pharmacist. A pharmacy technician is not authorized to transfer controlled substance prescriptions. Understanding this regulation is vital for maintaining legal compliance and ensuring proper handling of controlled medications.